Many of the technologies and medical breakthroughs we rely on today began with a simple question: what if? Electricity, antibiotics, the internet, vaccines, artificial intelligence. History shows that the greatest advances often begin long before anyone knows where they will lead. Today, discovery researchers and innovators are exploring ideas that could transform healthcare, technology, and society in ways we cannot yet imagine. What breakthroughs are being developed right now? How do ideas become innovation? And what might the world look like because of research happening today? This is Discovery, Research, and Innovation. Are you working on discoveries in this field that could change the future of health, medicine, society, or science? We would love to hear from you and share your work and stories with the world. This is the Dr. Watt podcast. Yeah,
Thank you, Josh, for the invitation.
yeah,
My name is Sherif Elsharkawy. I'm a senior clinical lecturer and honorary consultant in a field called Prosthodontics at
yeah.
King's College London. I'm a dentist by
Mm.
qualification and a bioengineer.
Okay.
I did my PhD in bioengineering and material science, and I did my bachelor in dental school. So I'm a kind of both a dentist and a bioengineer.
Yeah.
Yeah, so that's, and then I'm an academic at King's. I run a research program where we are interested in developing novel materials
Yeah.
for multiple applications, mainly for dental and some biomedical applications.
Yeah.
And as you mentioned, we are really inspired by nature, and how can we love nature,
Yeah.
and we're trying to use what nature like does in a smart way, and try to repurpose that in our favor to kind of, as you mentioned, to improve longevity for human beings and survival.
Yeah. That's amazing. I mean, it must be quite a busy life because I know being a dentist is quite difficult already, and you're also juggling that as well with the life of being a bioengineer. What? Let's go back to the start. How did you want to get into bringing these two worlds together? How did it all start for you?
Yeah, that's a really good question. So when I graduated back in Egypt
Okay.
in a city. I'm not sure if you know Alexandria. It's a northern city of Egypt. It's just very beautiful. Has a seaside,
Yeah.
and I did my undergrad there. After I finished my undergrad, I did about maybe 3 years of dental work, purely dental work in hospital and in dental practices. So I wasn't really involved in any kind of research at the time, but at that time I felt like, okay, now I'm within these four walls. I'm doing a service for patients, and I'm very young, and I actually question some of the techniques that we do, some of the materials that we do. So I start to question myself: am I really convinced of what I'm doing, or
Yeah.
just doing it just for the
Yeah.
sake of doing it? So I stopped there, and I said, no, I don't want to continue my life
Really?
like that. So I started to look up programs that I had this idea of enamel regeneration. How can we make materials that mimic dental enamel? So when I did my service to the patient, we usually use plastic and resin, which is not environmentally friendly and doesn't really mimic what we replace, the
Yeah.
original tissue. So I said, okay, no, I need to find a way. And that time I started to look up programs that are kind of interested in research, and the area of interest at that time was tissue engineering.
Yeah.
And I was lucky enough that I have a mentor back in Egypt. She was US trained, and she was very, very knowledgeable. I was so lucky. Her name is, I always mention her name. Her name is Professor Mona Mari. And she kind of gave me that exposure that there is another word, that people are developing things, working on new technologies. So she gave me the flavor,
Yeah.
really, and guide me that there is a way there. So I started to look up programs in the UK here. I started a master's program at the
Mm.
beginning. So I came over from Alexandria, did 1 year master's in a field called oral biology, which is basically basics of biology of oral, the mouth.
Yeah.
And that helped me a lot to kind of get my foundation really right. Um, and then, yeah, things started since then. I mean, I had my during my master's project, we've developed something new, and then I continued working on that during my PhD. So I've got PhD funding scholarship from Queen Mary University of London at the time, where I really focus on my research program. And during that PhD, we've discovered something amazing. We've discovered something that this is the first real enamel regeneration technology.
Okay.
We use the back of some proteins as well, recombinant proteins made of elastin, which is basically the tendons and skin at the time. And we were so excited. That was the first real enamel regeneration, and that was heavily picked up by the scientific community.
Yeah.
We published a really major paper at that time in Nature Communications, which laid down the kind of the breakthrough,
Yeah.
and the media has picked up this quite a lot. And then after that, I spent 2 years working on this technology. We've got multiple patents on that. Then I moved to King's, where I've started to develop my own research program, and I've taken few other milestones
Yeah.
around that. I realized some of the limitations of my previous discoveries, and I wanted to work on something that is sustainable,
Yeah.
easily to be translatable as well,
Yeah.
and affordable.
Yeah.
We believe that for the regenerative medicine, it doesn't have currently. Unfortunately, the regenerative medicine is very uh, like luxurious.
Yeah.
Not everyone can access, and it's not very affordable either. So we have a belief that we should make regenerative medicine as affordable, as accessible, and global as well. So here comes when we kind of develop our own ideas, is develop something that is actually can be scaled up.
Yeah.
And that's when we started the project on keratin. At the time when we came here, I had my first PhD students. We worked a lot on the keratin, and yeah, I can expand on that, but I just wanted
Yeah.
to give
That's
you,
great,
yeah,
actually. Wow. I can tell that you're really driven by curiosity, like trying to understand, not just being comfortable with what we know now, but what can we know more and what questions are yet to be, to be answered. And let's just go with how are you really inspired by nature? You can give me an example of some of the, the work that you've done that is really inspired by by the natural world, and that has really transformed your way you're translating that into biomaterials.
yes. I mean, most of the work that we do has sort of inspiration, must have something that we inspired by, especially in nature. So, for example, one of the work that we've done on improving my denture patients. So I see a lot of patients that has no teeth at all in practice, and they need dentures. Not all patients can actually have implants. Implants is quite expensive to have fixed teeth, and not everyone, not just for financial reasons, some people cannot have it for systemic disease or medical problems. So unfortunately, not everyone can have this implant treatment. So, and the denture are really depending on the retention. So
Yeah.
it can be really embarrassing when they speak or eat, they started to fall down. So at the time, like, okay, during COVID, actually, was it sounds a bit weird, but I'm gonna say it. I was eating a peach
Yeah.
during COVID. Despite I'm quite allergic to peach, but I really like it. So there is a piece of the skin of the peach that has stuck in the top of my roof of the mouth.
Yeah.
And it was really sticky, and I tried to kind of take it off, and that started to question myself. I was like, how did that happen? And I looked up like the skin of the under the microscope. How does
Yeah.
it look like? You got this little hairy stuff that actually has the capability to grip and
Okay.
increase the surface area. So I said, okay, which we can something we can take
Yeah.
and use from nature to dentures, because the denture sits in the same place. If we modify the surface, the fitting surface of the dentures with some topography
Yeah.
that can actually get a retention. And at the time, like, we've got different candidates, including geckos' feet, like they
Oh, wow.
climb, they
Yeah.
have really nice fine fibrils in their feet, which make them grip really well to walls, so they cannot really fall against gravity. That one of the candidates, we had tree frogs, which as
Okay.
well really have this kind of capability, and octopus for sure. So the octopus suckers are really famous for gripping really into hard surfaces. They have
Yeah.
soft suckers which have the capability to grip
Yeah.
really nicely thanks to the suction cup they have. So we've got these different candidates, and we started to kind of tailor by engineering kind of the designs of it. We kind of modify it,
Yeah.
And it was really fascinating to see the results. Like, we've improved the retention of complete dentures
Oh wow.
almost double. So we've increased it to double the amount, and we're getting to levels that are very close to what people use as adhesive,
Yeah.
which is not very sustainable. Lots of plastic in there, lots of tubes, and it's not very hygienic either. So we can actually use nature in our favor to help
Yeah.
our patients. So that one of the examples that we've developed, and that actually has really made quite good impact too. And now this is something that I want to kind of give to the patients as a technique, like kind of people
Yeah.
can improve their dentures by using this new technique.
Yeah, that's amazing. Wow.
Yeah.
I can literally see that you're getting feedback from people and seeing how to improve people's quality of life. And this always has to do with human interaction and how science or innovation doesn't happen in a closed system. You know, we're mostly inspired by the natural world and but also people.
Yeah.
You know, and you're also a dentist as well and
Yeah.
prosthodontist working. So how is it that your daily life in the clinics and seeing people you know, coming to clinics day after day, how does that really sort of inspire, or do they ever tell you stories? Do you ever get to talk to them, and how does that inspire you to then go back to the lab as a scientist?
This is very important. And I always say that interacting with patients and human being, you actually hear and you actually know the real problems. And as a clinician, you know what are the problems with the materials that you do, like what fails, what doesn't work, what works better, and where are the areas that needs improvement. And having this capability to actually work with patients, which I still insist to kind of have my hands into it, and not just purely research, because I value the importance of that, because it's basically giving me new ideas,
Yeah,
so I can go back to the lab and develop these things. And I'm bridging this gap. I feel like we need that, like, to bridge the gap between patients and science.
yeah,
And the only way to do that is that ideally to have a collaboration and have interdisciplinary teams, which is very important. But imagine if the person who actually is seeing the patient for these problems and actually have the capability to do the research as well. So
yeah,
that have given me a really, really, I would say, sweet spot
yeah,
where I'm operating the interface between patience and science.
yeah. That's amazing. And how do you manage that life? Because I do think it can get quite time consuming, and also this is why some clinicians, some doctors just prefer to become purely clinicians and they don't do research, not because they don't want to, but because when they thought about the life cycles and trying to maintain all the different parts of your life, it's just quite difficult.
Yeah,
So how have you managed, you know, these different areas of your life?
sure. I mean, it's giving me motivation, like seeing the patients giving me motivation.
Okay.
I think it's because I see the direct impact.
Yeah,
So we usually talk about impact in research. People say impact, whereas what is the impact and how did that impact people? So, and I understand that from a research point of view, but as a clinician as well, when I treat patient and I see the, like, kind of the happiness in them when they have something sorted, or the comfort or pain relief, or like kind of changing their life. Sometimes our treatment can be life transformative. So you can actually see the direct impact in their
yeah,
eyes. And I actually got, this is a very rewarding feeling when you feel like you actually help someone. So I operate on this direct impact. So I know what impact means
yeah,
as a clinician. I know, like, direct impact. The problem with the clinician or clinical work, when you do direct impact, it's mainly limited to the amount of patients you see.
yeah,
Unfortunately, you cannot really clone yourself and do a million patients at one time.
yeah,
You cannot have this wider impact. You can have direct impact, which is really important, but that gives me motivation. So the research, I can make similar impact to patients, but at a really, really big scale.
yeah,
Because if we develop new material, develop new technique that can be implemented globally,
yeah,
then that will give me that nice feeling that I have when I do direct impact with patients. So I hope you understand, like, what I mean by
yeah,
that, because it's actually really nice to see the impact, but then that give me motivation that, okay, now I can make it global. I can get this to everyone, and
yeah,
that's how I see the benefit. And yes, I agree with you. It can be really difficult to juggle those
yeah,
different things, but I feel like I've reached a balance where I'm really comfortable with. And as I said, like, I'm taking my strength from both areas.
yeah. That's amazing.
Yeah.
And then, like, with the impact of research, and you've also talked about how your work is changing the landscape of regenerative medicine and biomaterials. What do you think the story has been in regenerative medicine and biomaterials over the years? What do you think were the problems at the many, let's say, 20 years ago in that field, and has any of these problems been solved today? And what do you think the future looks like for regenerative medicine and biomaterials?
The future is great. I think in regenerative medicine,
Yeah.
it's going to change our life completely, and I think it's gonna have an impact on longevity.
Okay.
People will live longer uh, because of these technologies. Like because we really we had a lot of technologies that helped us shape this field. Like that regenerative medicine field is also reliant on other fields. So like engineering, for example. So there is a lot of advancement in other fields that has helped regenerative medicine and is
Yeah.
continuing to advance. And I see like in the next like kind of 20 years, these regenerative medicine solutions will become more and more available,
Yeah.
will become more and more accessible, and there will be more evidence on their use and research. So it's
Yeah.
not going to be just a concept. The last maybe 30 years is just maybe
Yeah.
more conceptual, more mechanistic and understanding and dreaming, I would say. Like we dream about this, and the research is giving us the hope. But now is the application. So I think we're going to have an era of applying
Yeah.
what people have developed in the last 30 years and build on that. And I think the current people like, who lives in this era will benefit from this.
Yeah. Yeah, and also, I know you mentioned earlier about affordability of science innovation, and how as much as good as any treatment or any advancement can be, if it's not affordable to everyone, then it's not the impact is not really felt. So, what do you think? How can we make science more affordable, especially in your field?
Yeah, as I said, like finding from the beginning the right materials and the right tools that you need to work with.
Yeah,
And be realistic. I mean, be realistic because you need to understand the end product or like
yeah,
what is the end result and who's going to access it and who has this problem. So all that I when I develop or design a project or design a new project, I have these ideas in my mind. I don't want to start with something that would never be applied or
yeah,
affordable. Because I've done this in the past. I've done this in the past, like where we develop some. It's really exciting. So we kind of go and work. Research is small samples. It's like you can really afford doing anything because you can just use a few milliliter here, micrograms. You can make it affordable for the lab. But when
yeah,
you think about scaling it up for industrial purposes, it can become really, really expensive or not feasible at all.
yeah,
We've seen lots of examples of really nice science that cannot make it to the bench or to the clinic
yeah,
because it's not yet. It's the science is amazing. Would love to have this technologies to people, but sometimes it's not feasible, not affordable. So when I select my initial design, I have that in my mind, so I know where I'm going. So rather than just reach what I wanted to reach and then find out, oh my God, this is so expensive. I cannot
yeah,
make it now. So you've wasted like 6, 7 years of your life doing something that not going to be translatable. So
yeah,
that's why I kind of changed my ethos a little bit to kind of have this really important because we believe that as human being we should be like there's some sort of equality and everyone should afford to get this
yeah,
science. It doesn't you don't have to limit it to certain people or make it very luxurious for the wealthy few.
yeah,
We have a belief in this.
yeah. That's amazing. And also, I mean, we can get into other people trying to learn from your life now. For someone who just finished dental school and has got their BDS and they're trying to figure out what next and because sometimes the career path isn't just a straight road that sort of goes from BDS all the way to being a senior lecturer now that you are. How can a young person starting off navigate the career path as a clinician, as a scientist, or both worlds, and sort of get to what sort of advice have you got for them?
My advice is that don't get into the thinking of I need to make money
Okay.
and just go do work, and forget about your brain a little bit. So that's my advice, is that don't get yourself too heavily invested in servicing. You would love to service people and do the clinical work, but I would say my advice is to try to develop your own a niche and think about something that you are really interested in, and maybe something that no one really worked on it, and try to be yourself in terms of really think what is bothering you in that clinical work, for example, and take responsibility. You said, okay, I'm going to change this. I want to change that part, because we need people that really think this way, because we can improve. Unfortunately, with the dental field, it's been really a field that has been driven hugely on financial, and dentists, they just think the same way. Okay, now I've graduated, I want to go to a clinic, work and
Yeah.
get money, and keep doing that for 5 days a week in a single room, not interacting with other people. So it can be very, very damaging. So I don't want them to do that. They can do it for some time,
Yeah.
but leave some room to innovate and find like solutions for
Yeah.
different problems. And if we have people working this way, a lot of our problems will be solved.
Yeah, that's amazing. And now we can go into your, your day-to-day clinical life. It might be funny. What are some of the questions you get asked
Mm.
from patients in clinics, or when you see them? What are the regular things that usually come up?
I mean, usually, like we have lots of problems that people face nowadays with missing teeth,
Hmm.
right? Missing teeth, it's a major problem in the UK as well. Here, like we've got statistics that we have 6% of people that have no teeth.
Oh wow.
So which is quite a lot
Yeah,
in this era.
it is a lot.
Some of them are unavoidable due to multiple problems, or some of them they can be preventable if they are picked up earlier. And that's what I'm really interested in. I mean, I'm interested in treating them for sure, because we're not going to leave them like that.
Yeah,
Developing new materials, for example, the octopus suckers, the dentures, implants, all these sort of things. Fine. But I don't want them to reach there as well. I don't want
yeah,
them to get to there if possible. And that's where we're working at the moment with our keratin project, for example. So we
yeah.
want to kind of prevent any damage that happened to teeth, so they don't really end up losing them
Okay.
at the end. So yeah, so that's the main issues, the missing teeth. So like this cycle. So I want to prevent this cycle from early, so to prevent even early decay. So tooth loss has been, there's multiple reasons for it, which is gum disease, decay, or like caries, trauma, all these sort of problems. I'm really working on that area
Okay.
to prevent like kind of primary disease
Yeah.
with the keratin work, for example, because what we found with keratin is really amazing. That as a human being, we can like kind of use this keratin to recreate what we've lost,
Yeah.
and that has been achieved like this in the world before. And keratin, as you know, is very affordable, very sustainable, widely available, and we can use it in a smart way to kind of recreate what people lost their enamel. And we've published paper that actually demonstrate that. And we're taking this to the real world. And one of
Yeah.
the really exciting things that we've developed recently is a spin-out company that is actually really focused into this. And yeah, it's called Eternal Regeneratives, which is the
Okay.
company. And the ethos of the company is that we want to have um, affordable,
Yeah.
high quality regenerative medicine, accessible and affordable globally. So that's our mission. And we work in dental area at the moment, but it's going to be beyond dentistry as well, because it's a platform technologies that we're developing, so it can actually be applied in multiple areas, not just dental. So yeah, we are really excited about this as well, to kind of go down this route
Yeah.
to see actual benefits that can people face. And that's the impact that I'm talking about, that actually now we can take the impact from direct to few people to millions of people. And that's what I'm really excited about as well.
Yeah. That's amazing. And how do you think you know the public perception about getting treatment or dentures influences in terms of like their teeth health? because some people are just scared of the dentist. You might
Yeah.
get it a lot. Some people just hate the sound of a drill in
Yeah,
your
yeah,
teeth,
I
and
know.
then yeah. So like, what do you think? Some of the, especially in the clinics, how does that influence someone just showing up, showing up for an appointment or something?
Yeah, yes, sitting on a dental chair is it's not comfortable. I understand, and I myself I dislike it. Like I had some issues recently, and I had to go to the dentist
Yeah.
multiple times. Luckily I've got good friends that
Okay.
they can help me out, but I understand it can be really uncomfortable and not a pleasant experience. What we try to do is we try to make it as pleasant as possible to them to kind of try to come and enjoy, because I hear this comment all the time, like,
Yeah.
I hate dentists. Okay,
Yeah.
I know, I know, I know. No one does, but we'll try to make your journey like kind of we try to make your journey nicer this time,
Yeah.
and I usually try to assure them. But yeah, I mean, it's it's the problem in the first place. Okay, what we trying to develop, that doesn't mean that we gonna get less patients.
Yeah.
We still gonna see patients because the problems that we face, but we want them to come with real like kind of problem that can not be avoidable. What
Yeah.
we If we can try to avoid something, would be great, and then they can have their teeth for longer period of time.
Yeah.
Because there are some, actually, if, I'm not sure if you've looked into that, Josh, but there are some reports that saying like in the future people will live much longer,
Yeah.
much longer, especially with these new technologies for regenerative medicine and
Yeah.
improving health. People may actually live to 150
Yeah.
years.
Oh, wow.
Yeah. So imagine 150 years with that same teeth, right?
Yeah.
So you need, and we cannot have multiple sets of teeth,
Yeah.
unfortunately. So just have two sets. Let's try to make these sets good enough
Really
to
good.
stay. So yeah. So, and the organs as well. Like that's why regenerative medicine is very important, because it's gonna regenerate and replace, not just repair, replace
Yeah.
organs, and so people can live longer. Because it's, I don't want to go into philosophical stuff,
Yeah.
but I have some thoughts about this. But we can make, it's like the body is the engine, right? If you
Yeah.
have parts that has been working well, you can actually replace that whole part. And
Yeah.
that's how we see people can actually live to 150 because of these technologies nowadays. And we are working in that ethos as well. We're trying to just focus on the teeth. So okay, now
Yeah.
people can live longer with their good teeth, because that's my expertise. I'm sure my other colleagues in other different areas, they are working in different organs. So
Yeah.
it's, as I said, it's collective effort from the scientific community to
Yeah.
allow the human being to kind of live high quality life for longer.
Yeah. Oh, that's amazing. I mean, we're coming towards the end of it now, but we'd like to talk about, the future. What are the things that inspires you,
Mm.
as a person to sort of keep going, to keep showing up in clinics every day and keep doing research? And then it could be a person, it could be your girls,
Yeah,
it could be your lab.
yeah.
Yeah.
I mean, my family
Yeah.
definitely inspires me for this.
Yeah.
Yeah, I mean, I live for them, right? So it's something that I want them to get the best life and to actually be proud of me as well, and I act like a model for them. So
Yeah.
that is driving me on a daily basis. Yeah. So
Yeah.
for sure, my family will come first as
That's
an
amazing.
inspiration. Yeah.
Yeah, yeah. I mean, I was going to ask about would you see your field in 50 years, but you already answered that in terms of people being able to live even beyond like 120, 130, and,
Yeah.
living as long as,
Exactly.
yeah, because with regenerative medicine, the organs become just spare parts that can easily be replaced. And it's just,
Exactly. And then with the AI, I mean, I'm
yeah,
sure everyone comes to podcast talk about
yeah,
AI. AI is going to help us a lot in dental field as well. It's going to help us a lot. We've got new technologies now. We can see robotics,
yeah,
implant placement, for example, like patient being placed implant by a robot, not by actual
yeah,
dentist. The dentist can just sit there and supervise the robot.
yeah,
So this is going to change a lot of our procedures, and it's very exciting to see this. And it's going really fast in multiple areas with the AI. I'm sure we are very productive as a
yeah,
human beings now. I think we can do stuff that you can do in 2 3 years. You can do it in 2 3 3 months thanks
yeah,
to the AI, and that's why we're gonna see exponential kind of improvement in multiple areas.
yeah. Oh, wow. Yeah, just and then lastly, I don't know if you wanted to say one final thing. What it would be an advice to people who are younger. These are like people in high school who they're probably finishing GCSEs
Yeah.
and they're thinking about going into the dental field. You know, what do you say to a young person who's dreaming about being a doctor?
Well, I would say the first thing you need to question yourself why you want to do this. Why is it something that the family wants?
Yeah,
Is it something that you really want? And that's the honesty question. So that's the honesty check. I think once you have this answer, it will help you a lot in
yeah,
the future, because if they're not really motivated by themselves about doing it, it will be a nightmare. And I've seen loads of examples, because yeah, families can push, I want you to see a doctor, I want you to be a dentist, blah, blah," and that it's not really coming from the person himself. And that can be really problematic.
yeah,
So that's my advice. Make sure that you want to do what you wanted to do, and then if you wanted to do it in a special way. Try to be special. Try to be your own, have your own mentality, and
yeah,
try and enjoy life, because that's a nice age and you can go enjoy life. But in the same time, try to find your own space, try to find your own area, and just do your own stuff on it, and
yeah,
try to develop your own niche. And that's why I usually have passion. Everyone should have a passion into, even if a small area, but you can be the best person in the world in that specific area, because you picked it in a very specific niche. So that's my advice. Not
yeah,
just Don't be just a normal person, try to be
yeah.
special.
Oh, wow. Thank
That's
you
it.
so much for
Pleasure.
being in today's podcast. And I hope you come back anytime we have another innovation, and then
Sure,
we'll
would
always
love.
have
I
you
mean, it
so
was lovely
much.
sitting
Yeah.
with you, Josh.
Yeah, it's
Definitely.
been wonderful.
Yeah,
Thank
yeah,
you.
yeah.
So I can't wait to actually, like, keep reading all about your work online,
Thank you.
and because I was yesterday I was listening to the BBC radio one that you did, and it was just amazing how you're making, especially how you're engaging the general public with your work, and it really stirs that positive energy with people in the world about research. And thank you so
Thanks,
much,
you, Josh.
Sherif.
Thank you. Thank you
Yeah,
for having me.
thank you. So thank you so much, everyone, for staying with this episode, and I hope you come back to next week's or next month's episode, where we have more guests sharing about their discoveries, innovations in all the different areas that we're interested in. Do share this video, like it, subscribe, and I just hope you keep staying inspired to also be a scientist or to share science with the world. Thank you so much.